I'll put my system level business hat on. There probably needs to be more reimbursement models, I think, for survivorship care, just as there is for treatment related care. I think we need to have better integration with our primary care providers. I really think there needs to be, more teamwork, more training for primary care in cancer care, cancer survivorship, even if it's just, educating each other, if it's, webinars, if it's, education session that they can um, learn from. I also think not only the individuals that finish, primary or early stage treatment, but there are a lot of childhood cancer survivors. Adults, young adults that have completed treatment for cancer that really need to have lifelong care for long-term late effects. And they're also at risk for developing a secondary cancer related to the treatment they received as a child or young adult, or are at an increased risk of developing, an adult, so to speak, cancer. We know with mantle radiation that they used to give individuals with lymphoma or non-Hodgkin's lymphoma that are at an increased risk of chest-related cancers. So, we need to be aware of what's available. So, regardless of your practice setting, if I'm educating, nurses that are in school that aren't oncology nurses, I'm sharing more than likely you're going to care for somebody that's a cancer survivor. So you really need to be aware of what are those resources in the community, even if it's just a phone call, hey, I have somebody that completed treatment. They're thinking of getting pregnant. Is there anything I need to know about hormonal therapy? What will increase their risk? So I think we really need to have those conversations. And also for individuals that are living with advanced and metastatic cancer, we have great treatments that are available nowadays, immunotherapies, targeted therapies. So individuals are living longer with stage 4 cancers and they're doing well. So where do they fit in the survivorship journey? They're ready to keep on living, and we want them to keep on living for as long as we can. And though, where do they fit in? It's a survivorship um, part of the continuum as well. As you mentioned with the Oncology Nursing Society, once again, the resources that we have available, there are courses, there are, the survivorship learning library for nurses at all levels. If it's the bedside, if it's navigators, if it's advanced practice nurses that have nurse-led programs where they can get access to resources, as well as our nurse scientists who may be researching symptom management. Back in the day, fatigue was a big initiative of the Oncology Nursing Society and nurse scientists. So there's a lot of symptoms that we see happening in clusters, and our nurse scientists that are PhD prepared are looking at those symptoms to help manage those side effects better. And there's resources and funding grants that are available through the Oncology Nursing Foundation for them to apply to. Also, leadership positions, quality improvement initiatives. This may work. Where will it work within my practice setting? And you mentioned a little bit about advocacy. Nurses, we hold our patients' stories, so I really think we need to share them with policymakers at the national level so survivorship care can be reimbursed at the level where it should be, and that survivors' voice are kept front and center at these conversations as treatment, as things are changing, as we hear every day in the news. We really need to share our patients' stories as we want continuing survivorship and care to be provided to individuals, and also the ones that we don't know about yet. We want them to get care as early as possible if they're diagnosed with the cancer so they can be more long-term survivors in wherever we are so we can help them get back on track.